Welcome back to the WHHI Daily News. Dr. Debi Lynes has joined us. She does once a month the Mind Your Health segment. Good to see you.
It is so great to see you.
I know you're coming off a TEDx, which was a big success this past Saturday. Congratulations on that.
Thank you.
And but today we're talking about the nomenclature, the language around mental health. Emotions versus mental health disorders. So
exactly.
We were just, you were kind of filling me in on kind of briefing me on this, but this is fascinating.
It really is, because I don't think we really think about it that much. There are many days where I've awakened in the morning and just sort of felt flat and like, I feel so depressed today.
But you're not really clinically depressed.
Correct. And so what we're trying to do, and I think in the field generally, is we're trying to formulate a language around mental health versus mental health disorders, so that when we all talk, we're all speaking the same thing. And a good analogy is, do I know the difference between COVID, the flu, a cold, RSV? So pretty much I do, and if I look it up, I'll be able to find the differences pretty rapidly. Not so easily done with mental health disorders. And what we did is I brought something in that just said, you know, when you get butterflies in your tummy and your kid's there, is that anxiety? No, those are butterflies in your tummy. You're nervous. Okay, perfectly normal emotion, even though it feels big.
Right. Okay. The next would be sadness. It can develop into clinical depression, but they're not the same.
No. In fact, the opposite of sad is happy.
Yeah.
The opposite of being clinically depressed is vitality. And vitality is defined as being able to get up out of bed, brush your teeth, take a shower, and function. And so they're really not even in
the same ballpark.
They're really not. Many of us have body image issues. Okay, that is not an eating disorder.
But it could develop
into
an eating disorder.
And that's why these words are so important for all of us. Again, feeling yucky, like I don't want to get up in the morning and like I just don't even want to be here, having a thought of death or not being around is very different than suicidal ideation. And again, if we can develop language around this, it's really helpful for all of us. The other thing that's kind of fun, I know, poor Robyn, you open your mouth to say something, I'm like, wait.
I just want to ask, when do you need help? If you're sad, can you kind of work that through? You know, I just don't. I'm sad today about a particular, family issue, whatever. But when do I need treatment? When do I need some therapy? And there's short versus long term too.
And therapy is coaching. Therapy is education. Therapy is resourcing. So if any of these things have a negative impact on your quality of life,
very good.
For more than test anxiety, I feel test nervousness. Well, if I feel test nervousness and it happens every single time I take a test, and oh, by the way, I didn't finish it or I froze, I think it would be helpful to come
get help
and get a little bit of help. I think one of the other things, and you and I chatted about this before, is you can have a mental health disorder and be perfectly sane. These are not mutually exclusive things. Okay? Having a mental health disorder is simply a way that we, through language, can decide on treatment options and opportunities that are appropriate.
And so I would assume in your work, you are very careful about the language that you use with parents or the adolescent you work with or the adult to help them understand that it's more of an emotion. It's not really a mental health disorder. So
correct. There are thoughts, there are feelings, there are beliefs, there are emotions, and if we have a language to define those, it will be in our favor for diagnostic reasons and treatment.
Very good. This, as you know, this mental health is a very important topic to me personally in my life and to many of our viewers out there. So I appreciate, once again, you bringing your good advice and your tips. Dr. Debi Lynes, who is with us once a month for her Mind Your Health segment. Thanks, Debi.
Thank you.
And we'll be right back with more WHHI Daily News. Don't go away, everyone.